Hello, my name's Lizzie. I'm the Paramedic Ambassador for Hertfordshire and West Essex Training Hub. I've been asked to deliver this presentation to you as part of your induction as a new paramedic to Hertfordshire and West Essex Primary Care. So firstly, welcome very much to the team. It's wonderful to have you. We are looking forward to you having a wonderful career in primary care. There's lots of exciting things ahead of you, and we hope you're very much looking forward to it. So what might your role include? Now this depends on where you're working, the demographics of your patients, and also your past experiences and training and education and areas that interest you. So your role may be different depending on which area of Hertfordshire and West Essex you work in, but I've detailed here some of the things that paramedics across the area do on a day-to-day basis. So things like home visits for new acute conditions, supporting patients in their end-of-life care, supporting patients to discuss their advanced care planning and escalation of care, recognition of death. You may be asked to go and recognise a death in order that a GP can then complete a death certificate. Many paramedics across the area do a minor ailments clinic on a day-to-day basis, which would include minor illnesses and injuries. You may choose to go ahead and gain your prescribing qualification. Your non-medical prescribing module at the university would need to be completed for that. You do need to complete a year in primary care before you would be eligible for a prescribing module, and it's also a requirement of most universities that you've done an advanced assessment module, so that might be worth planning in if that's something that you would like to achieve. There are paramedics across the area who provide a weekly ward round in care homes or nursing homes, managing the health of the patients there. You may also choose to take on a long-term condition clinic, something like asthma or heart failure may be of interest to you. That may be something that you've got a lot of experience and knowledge in, but you may also want to develop in that area. Some PCNs and GP surgeries also ask that their paramedics support by providing basic life support or advanced life support training depending on their needs in their area. It's important to discuss with the CCG and local CQC guidelines around what qualifications you'll need in order for your training to be official, but absolutely something you can do. Common skills like cannulation and wound care, all within your scope of practice and work at a level that's suitable for you. You may spend time with nurses or other professionals within the practice to develop those skills around phlebotomy and wound care, but absolutely something that would be within your remit. So all paramedics within primary care are now required to complete a first contact practitioner portfolio. This is a way for the CQC to see evidence that you are working at the appropriate level within primary care. So this is a portfolio that you develop alongside your supervisor within practice to evidence your skills and capabilities and to allow you to develop within specific areas. The document's available online and there's guidance through the training hub and also through the College of Paramedics around completing that. So if you do need any help on that, please do contact the Paramedic Ambassador and we'll be pleased to help you with that. So some resources that may be helpful to you. Listed first is the Training Hub website. Do check regularly. We try to keep it updated with all of the local webinars and training courses and opportunities available. If there's anything that you're interested in training wise that isn't listed on the website, then do get in contact with either your PCN educational lead or directly with the Training Hub, and absolutely we can look at whether there's funding available for that. There's various different pools of money, so we're keen to support you if at all possible. Also, I mentioned that all of the hospices within the local area are very keen to support primary care and community care colleagues. So if there's any educational training needs you have around end of life care, palliative care, writing of DNARs, advanced care planning, then do have a look on the hospice's website. They generally have an educational brochure that lists all of their courses, which range from a half-day course, sort of bite-sized webinars, but they also have longer courses depending on the topic area. Also, I mentioned that there is funding from Health Education England for paramedics to complete their Masters in Advanced Clinical Practice. So if that's something you're interested in, then please do speak with us at the Training Hub and we can put you in touch with the funding for that. The College of Paramedics also has a very active champion for paramedics in primary care. She's very keen to hear from paramedics and to support as need be. So do have a look on their pages for more information there. And finally, do contact your paramedic ambassador. I'm keen to support all of you. So we also have a Teams chat and a WhatsApp group. So get in contact and we'll add you to that. We may be able to answer some of those niggly questions that you have when you're starting out, and just be able to give you some peer-to-peer support on issues or raise anything further if need be. So we just want to wish you good luck. There's a wonderful career ahead of you. There will be lots of learning ahead, and we really want to support that at the Training Hub. So contact us if there's anything that we can do to help you, but make the most of it. Enjoy meeting new people and enjoy your time in primary care.